The issue of pigeon droppings and the ban on pigeon feeding in public places, especially like this one, which is the Dadar Kabootarkhana, has led to protests from the Jain community, which claims that this is a central tenet of their religious practices. And therefore, there is a protest here at Dadar, where, of course, you can see the community members outside a temple protesting against the ban on feeding pigeons in public, which has come into force after a Bombay High Court order. Now, the government, of course, has discussed the issue at a cabinet meeting. The Chief Minister, Devendra Fadnavis, has said, find a middle path. And while religious sentiments have to be respected, health concerns also have to be kept in mind. And therefore, whether there can be some middle ground worked out is what the government is considering at this point. But the Jain community here in Mumbai, outside, protesting at this point at the Kabootarkhana, as protests are taking place here in Mumbai against the ban on feeding pigeons in public places. And you can see, of course, these there's an attempt to block the road here while the police try to push the protesters back to remove people from blocking the road. This is in the Kabootarkhana area of Mumbai, and the police, of course, trying to tell these people to clear the road as there is, of course, this ban has been implemented on the Bombay High Court's orders, and this is something that is happening in Mumbai's Dadar area at this point. You can see in these pictures, protesters from the Jain community are attempting to tear the cover that's been placed on the Kabootarkhana on the orders of the Bombay High Court. Protesters are breaking down the cover that's been put up by the BMC to stop pigeon feeding in public places, and this is on the orders of the Bombay High Court. The police, of course, are trying to remove these protesters as they try and tear apart the cover that has been put up here by the BMC. You can see protesters have gone into the Kabootarkhana here, and of course they are trying to break down this cover. And you can see people, also you can see people trying to feed pigeons. Here you can see these are, of course, community leaders who are trying to, sort of break down this thing here, the whole Kabootarkhana. And you can see, of course, women there also breaking this and, dropping pigeon feed here, and so that the pigeons can eat. And of course here there is, of course, a scuffle with the police between protesters who are trying to block, tear apart this cover that's been put up here by the police and the BMC on the orders of the Bombay High Court. So a protest by the Jain community trying to tear apart the cover that has been installed to block and cover the Kabootarkhana here in Mumbai's Dadar area. Pigeon droppings across Mumbai have become a health hazard. What are these health hazards? Who better than a pulmonologist to explain to us? Joining me now is Dr. Harish Safle. Dr. Safle, tell us a little bit about the health hazards that you believe could be the reason that is pigeon droppings.
Yeah. Hi, I am Dr. Harish Safle, serum pulmonologist from Glen Eagles Hospital. And as rightly said, health hazards to pigeons, definitely they are related. What happens actually, pigeons have 2-3 components which can be dangerous to the lungs, lung health particularly. One of the biggest component is basically the pigeon droppings, the shit that they pass on. Once they dry it and you try to clean them, it gets exposed to the air, and the fine droplets can go inside you. And the feathers also are there, which also when they fly, when you try to move them out of your home, they fly, and in the bargain they create a feather droppings to you. So both these, if they go inside your lung, they cause this problem. Problems in the form it contains special protein, which body reacts against it and creates something called as fibrosis of the lung. The lungs are usually a very delicate structure, like a rubber or a sponge, wherein we take in air, it expands, and we blow out, it just comes to the normal position. With the hazards of pigeon droppings, one part I explained of fibrosis, the lungs becomes very hard like a stone. the air doesn't reach in and the oxygen level of the body falls. The second hazard I would like to mention is basically called as cetacosis. The infection part of it, cetacosis, then bird fancier disease is another one, and few patients can develop allergic bronchopulmonary aspergillosis. It's one of the fungus again which can cause problems to the people's lung health.
And sir, I'd like to ask you, in your practice at the hospital, have you seen a spike in patients who have come in with lung issues that you can directly link to pigeon droppings or exposure to pigeon excreta?
So when I see patients in Gleneagles Hospital chest OPD, when I see a patient of pulmonary fibrosis particularly, and pulmonary fibrosis, I'll just explain in brief, is basically something people develop dry cough which is ongoing since more than 6 months. The breathing difficulty also associated with it, and there are other problems associated. So when I see, say, 100 patients of pulmonary fibrosis or interstitial lung disease, in Mumbai, the incidence of related to bird exposure and causing pulmonary fibrosis is to the tune of, say, 30 to 35%, I would say. And as the number of cases of pulmonary fibrosis are rising, definitely the component out of which the birds are causing pulmonary fibrosis is going up.
What precautions can people take to prevent, being exposed to pigeon droppings? Because I don't think we can wish away pigeons. Kabootar ja bolne se to nahi jayenge. But and there is a considerable concern over how to do it also. But so what precautions can people take to prevent themselves from, being susceptible to what you just mentioned?
Yeah. So precaution, I would say, if you still want to continue feeding pigeons or if you want to still go in acquaintance with them, I would say mask will be the biggest precaution that one can take. And that too, wearing the mask properly is very important. The nose clip has to fit your nose. The air and the other things should not go inside when you are wearing a mask. The mask should not be just on the mouth to show, but not on the nose. The real way to wear the mask should be followed properly. And biggest precaution is basically stay away as far as possible. So if they come in your window panes, basically, then you can put some protection there, some nets or something like that, so that you can avoid a direct exposure. And if by chance they pass their shade there and it dries out, you want to clean them, then you have to be very careful. While cleaning, you have to take extra precaution, because while cleaning, it is going to go in air, and that air you are going to inhale.
So there also masks.
There also masks is definitely important.
And largely, sorry, I think you've explained, but any generic sort of health warning that you can give people who are, say, unfortunately have to cross areas or stay in areas where there is a considerable pigeon population, what should they watch out for?
So they should watch out for symptoms like, first I would say is a dry cough, which usually now in this rainy season, usually people relate to the viral infection that's ongoing rampantly. But if this dry cough or any part of cough is not going, say for more than 3 weeks or a month, then first thing they should go to a specialist to take diagnosis why it is coming. It should not just be lenient that it is a viral fever causing cough. Try to investigate why it is coming. And if this dry cough is associated with breathing difficulty, like for example, if you can walk 2 flights of stairs without any breathing problem, and now you feel little unaccustomed to breathing, basically feeling one's own breathing is called breathlessness. So if you have that symptoms and it is progressing, the progression has to be very carefully taken, and it has to be investigated to the depth that is there a pulmonary fibrosis coming up, or is there something that we are trying to miss out on, that the specialist can tell you better, basically.
Thank you so much, doctor, for all your advice and sharing those details with us. Thank you so much for speaking to NDTV.